Detectives, innovators, counselors, advocates, and humanitarians, you're invited to meet the medical doctors of the OC Healthcare Agency.
Hi, my name is Dr. Piper Lillehoff, and I currently hold the position of Community Mental Health Psychiatrist at the County of Orange. I started my education in medicine at the University of California, Irvine, where I was pre-med, and majored in psychology. Then I subsequently entered medical school at the Medical College of Pennsylvania and decided I wanted to be a psychiatrist there. So since graduating from my psychiatry training, I have been at the county for approximately 15 years. My specialty includes doing psychiatric interviews and evaluations for children and adolescents and determining whether they could potentially benefit from medication management of psychiatric disorders. If so, then I continue to see them on a monthly basis on average for medication management and to ensure they're having a positive response. And I work collaboratively with the therapists as a comprehensive mental health care team. I actually first was interested in psychiatry when I was a senior in high school and my grandmother was misdiagnosed with Alzheimer's and came to live with us. She had delusions and hallucinations, and it was a blessing in disguise. She had a seizure. They discovered a brain tumor, and it turned out that that was creating all the psychiatric manifestations, so I became fascinated with brain science. She subsequently went on to become an independent retiree and moved out of the house after she recovered. So that was very inspirational to see her recover from that over a course of approximately a year. What inspires me the most is seeing the incredible commitment that the team has to making a difference early on in the children's lives, and also the fact that despite everybody's own personal struggles and trials and tribulations, we still are able to create that difference in other people's lives. I think that's really, truly inspirational. We practice what we preach. Perhaps that I have an avid interest in alternative holistic health interventions and the burgeoning research field. The National Institute of Mental Health is doing research on supplementation, vitamins, omega-3 fatty acids. I think there's even studies on mindfulness-based stress reduction, which is a type of cognitive behavioral therapy. That was an area that I was interested in prior to medical school. It was pioneered by a researcher at University of Massachusetts, Dr. John Kabat-Zinn, and that's used in major medical centers across the country. That seems to be a fascinating new field of research, so I like to keep up on that. That it's been my distinct privilege to serve the community at large, because this is my hometown and I feel like I'm giving back to the community I grew up in, and it's also great that the county has had a green ribbon campaign to dispel the myth that the mind and the body are disconnected, that they're all one entity, and there should be no stigma as a result of that. And I think that gave me a lot of pride this year that the county had a green ribbon campaign to dispel the stigma of mental illness.